Welcome. My name is Betsy Mann. I'm Assistant Professor at the University of Mississippi Medical Center. I'll be assisting Dr. Luther with N669 Role Development and Role Enactment. In this module, we will be discussing Boards of Nursing and APRNs. During the module, we will discuss the functions of Board of Nursing, the process for applying for APRN certification, requirements for monitored practice, applying for controlled substance prescriptive privilege, requirements for QA, QI, and the recertification process. The Board of Nursing, I've included here the website for your easy access. One thing that you must realize is that the Board of Nursing is a consumer protection agency. It is to provide protection to the public. It is a regulatory board. They're responsible for discipline nurses. They also monitor the practice of hemodialysis technicians, LPNs, RNs, and advanced practice nurses. As we talk about the functions of the Board of Nursing, we must understand the difference between the Mississippi Nursing Practice Law and the Administrative Code. The Mississippi Nursing Practice Law is the law. It is legislative approved. It must be voted on and approved by the legislature. The Administrative Code is the rules and regulations that outline the nurse practice law and what you should and shouldn't do. This is voted on and approved by the Board of Nursing. The Board of Nursing is a 13 panel. It includes 11 nurses, which include LPNs, RNs, APRNs, nurse educators. It has one consumer and then one physician, which serves also on the Mississippi Board of Medical Licensure. The staff at the Board of Nursing, they carry out the rules and regs approved by the board. The process for application. Once you complete this program, the Administrative Code Part 2840, Chapter 2, discusses advanced practice registered nurses, and this includes certified nurse midwives, certified registered nurse anesthetist, and certified nurse practitioners. It includes step-by-step the certification, your practice requirements, and your prescribing habit. With initial certification, you must currently be licensed as an RN in Mississippi. You have to comply with the criminal background checks and fingerprinting requirements in accordance with the Mississippi Code annotated section 73-15-191. You must submit all required applications and fees, and you must submit an official transcript of graduation from an accredited master's degree or higher program with a major in nursing in one of the 4 recognized advanced practice roles in which clinical experience has occurred. And those are the roles that we just discussed, plus a clinical nurse specialist, which right now in Mississippi we do not recognize clinical nurse specialist. That is in the process as the administrative code is being revised and looked at, that they're looking to include clinical nurse specialist. Let me just say about the criminal background checks. If you have graduated from an undergraduate program in the last 5 years and you had a criminal background check done at the Board of Nursing, then you will not be required to have another one, but only if it was done at the Board of Nursing. And you must have this criminal background check done. It does not include the one that you had while you were in school. You must have the criminal background check done at the Board of Nursing. During the process for application for your advanced practice registered nurse privilege, please read all instructions carefully. Again, you must have an active RN license in the state of Mississippi or a compact RN license for a compact state. You will not receive a compact privilege to practice as an advanced practice nurse. You will only be allowed to practice in Mississippi on your advanced practice registered nurse privilege. You need to submit official evidence of graduation. You can apply for your advanced practice registered nurse privilege before you actually graduate. You would just need to send an official transcript once you have completed the program. So you could send a partial transcript that is not complete, and then you could send another transcript at your completion of the program. You also have to submit current proof of national APRN certification. This must be sent directly to the Board of Nursing from the National Certification Organization. As you are applying to sit for certification, it will be on there for you to check which board you want your results sent to. And as soon as your results are final, they will send the Board of Nursing your results. You need to complete a fingerprint criminal background check at the Board of Nursing and complete your application form in its entirety. Include your proper name, RN license number, area of certification, and your current contact information. New graduates will identify the site in which the 720 hours of monitor practice will be occurring. If you're in a specialty clinic, you need to give a brief description of the job requirements in that specialty site and submit all appropriate fees with the application. Your application cannot be processed if you do not submit the fees. This is the current address to send all your APRN documents. So I just wanted to include that. The board recently moved in the last 2 years, so just make sure you have the current address. Requirements for monitor practice. Once you graduate, you sit for your certification exam, you will have to have 720 hours of monitor practice. You need to submit this required practice documentation for approval by the board prior to big practice. So you will submit where you plan on practicing, your collaborating physician to the Board of Nursing before you actually begin practicing. So an individual can obtain an APRN license without having a practice agreement. However, in order to begin practice, the collaborative agreement must be submitted for approval. Graduates of an APRN program must have monitor practice with either a licensed physician or an experienced certified APRN while practicing for the first 720 hours. And we often get the question, what is an experienced certified APRN? The Board of Nursing looks at least 2 to 3 years of practice to be an experienced certified APRN. Collaboration. You must have a relationship with a collaborating physician or dentist, and the APRN shall notify the Board of Nursing immediately regarding changes in the collaborative consultative relationship with the licensed physician or dentist. There are lots of questions about collaborating physicians. First of all, you must have a comparable practice. The collaborating physician must have an unrestricted Mississippi license. You must be able to communicate reliably with your collaborating physician while practicing. And the Board of Nursing suggests having more than one. Protocols. Be sure your collaborating physician reads your protocol. Let me just make it clear that it is not a requirement of the Board of Nursing for you to have a written protocol. It is a requirement for the Mississippi Board of Medical Licensure for your physician to have a written protocol. So a lot of times that falls back on the APRN to make sure that that is there, in place, signed, stamped, approved. Because if your physician gets in trouble with the Board of Medical Licensure, then you're not going to have a collaborating physician. Do not practice without a stamped, approved verification of a protocol. What you print out on the Board of Nursing's website is not enough for the Board of Medical Licensure. You need to have a written protocol, what you will and will not do regarding your controlled substance privilege, regarding whether you're in the same practice, And I have an example of one that I can post on Blackboard for you. It is not by mean what you have to have. It is what I have. And according to the Board of Medical Licensure, it's more of what they're looking for. Again, let me say, this is not a requirement of the Board of Nursing. This is a requirement of the Board of Medical Licensure. So your physician needs to know what is required of them as well when they're getting in a collaborating relationship. Requirements for QA. The format determined by the APRN physician and agency administrators must be sufficient to provide valid evaluation of practice. The collaborating physician must have documentation of review available for review by the Board of Medical Licensure if they come for an on-site inspection. The APRN must have documentation available for review by the Board of Nursing if they come for an on-site inspection. You must have face-to-face interaction between the APRN and the collaborating physician at least quarterly. You have to have requirements for the QA monthly. The sample size is 10% of patients seen per month or 20 charts, whichever is less. So if you see less than 200 patients a month, then you're going to have less than 20 charts, and you want to do the 10%. If you see more than 200 patients per month, then you only have to have 20 charts reviewed. It should be a varied and provide a clear picture of the patients that the APRN cares for, varied in ages, diagnosis, sex. Again, this should be a monthly review, and quarterly signed by the collaborating physician and APRN. I practice with my collaborating physician. He signs my QA every month. We meet basically every month, but once a quarter we sit down and we discuss other, we have an opportunity to discuss other evidence-based practice, new guidelines. The APRN site visit, you must have your credentials posted for Truth in Advertising Law. The APRN name must be clearly identified at the practice site and your collaborating physician. And again, with the signed protocol on site, that is the Mississippi Board of Medical Licensure requirement. The Board of Nursing wants to see an emergency plan, a written plan on what to do in a patient emergency. I have included this in my protocol so that it's all one document and I don't have to have 15 different documents if they come to for an on-site inspection. This is an example of what my QA looks like for each month. And basically what I wanted you to see, this is not what you have to do by any means, but it includes all the required information that the Board of Nursing is looking for. Once you have completed your 720 hours of monitored practice, you can apply for controlled substance prescriptive privilege. This is a privilege. A lot of people take advantage of this privilege. You will be required to attend an orientation for the Board of Nursing once you complete the program, and they will go into much more detail. A lot of the information that I have comes from that orientation, so you will be hearing some of the same information again. The first step you need to do is make sure you have your 720 hours of monitored practice documented. You need to keep a log for your records. You need to submit a letter that you have completed the 720 hours, signed by your preceptor, collaborating physician, and yourself to the Board of Nursing. At this time, you also can submit the application to the Board of Nursing to apply for your controlled substance prescriptive privilege. Once you have been granted, permission, you can apply to the DEA website. For their application, when completing the DEA registration application, you should enter your APRN license number, which will be the same as your RN license. You will not have a state-controlled substance number. The DEA will be notified of all approvals for prescriptive authority by the Mississippi Board of Nursing. Only then will your DEA license be released to you. Once you receive your DEA license, you want to submit a copy of it to the Board of Nursing. Your DEA license is renewed every 3 years. Prescriptive authority for controlled substance is to be renewed every 2 years. So you will renew your license with your advanced practice privilege and your controlled substance privilege every 2 years, when the same as RNs renew their license. But your DEA, you have to renew every 3 years. Requirements for approval are a minimum of 2 hours of continuing education in the area of controlled substance used in practice. So you want something that is pertinent to you, but you have to have a minimum of 2 hours of continuing education in the area of controlled substance. The cost for DEA is approximately $700. Recertification process. You'll have another lecture module on the total recertification process, but the main thing I wanted to point out was recertification for your Mississippi license coincides with RN license renewal every 2 years, and that's in even number years. Continuing education, you have to have 4 CEUs or 40 contact hours every 2 years. And 2 hours, again, must be concerning controlled substance. Whether you have controlled substance prescriptive authority or not, you still must get 2 hours. 2 hours of your continuing education must be in control with controlled substances. And your continuing education must be related to your advanced practice clinical practice. So make sure that you're attending stuff. You can do it online. There's no requirement of how many face-to-face hours you have. M&A offers a lot of continuing education throughout the year. You can obtain your 4 hours however you want to, but it needs to be pertinent and it needs to be related to your practice. While you renew your RN license, your APRN privilege, your controlled substance privilege every 2 years with the Board of Nursing, you must also maintain certification through National Certifying Body, AANP or ANCC. So you will need to go to their websites, their requirements. It's usually every 5 years for their recertification process, but you must be nationally certified to maintain an APRN privilege in Mississippi. I hope this has been helpful. I want you to realize that the Board of Nursing is a regulatory agency. It is consumer protection. They monitor the practice of nurses, whether they be LPNs, RNs, advanced practice nurses, and also monitor the practice of hemodialysis technicians. If you have any questions, please feel free to contact me. My email is sman@umc.edu. My office number is 601-984-6265, and my cell phone number is 601-416-5440. Please do not hesitate to contact me for any questions. If you have never been to the Board of Nursing, it is enlightening if you attend board hearings to see what nurses get in trouble for, to make sure that you do not do that. If you have not taken health policy and population health, you will have an opportunity to attend a board meeting, and I teach that course as well. So good luck. Please let me know if you have any questions.